Good morning and welcome to Solidarity with Jocelyn and Alex. I'm Alex Lawson, the Executive Director of Social Security Works, and my co-host Jocelyn McCurdy Keats is right above me on my Zoom, but I don't know if she's on camera yet. Uh, and we are really happy to be back on with our second episode of Solidarity. We will be joined a little bit later by a really, truly amazing individual, Dr. MarkAlain Dery. He's an infectious disease doctor from New Orleans and also owns and runs social justice radio station down there, WHIV. He's been fighting pandemics his entire life. And so he's going to join us to talk about what is going on with this pandemic right now, but also some incredibly good news coming out from the epidemiology about COVID as of right now. So I'm really looking forward to talking about that. Obviously, we do this show every Friday and every week of a pandemic. I think, Jocelyn, I don't know if you have good stuff happening. So I wanted to sort of toss the mic over to Jocelyn to see if you want to lay out some stuff that you want to talk about. I want to get into, and I'm going to bring it up with Dr. Dery as well, but the difference between the global coalition that is working together to end this pandemic, and then the US and the UK who are literally working against that coalition. And we are pouring billions of dollars into the pockets of these corporations for basically just a promise that they're going to do something. And I want to explore that and the very creepily named BARDA, and really let people know how this part of our government works.
Yeah, Alex, I mean, thank you for bringing that up. That is kind of the existential crisis we're facing right now as Americans, that our very bad ideas about how government and capital should function are really coming to a head at a time when thousands and thousands of people are dying every week unnecessarily. Our last show, you pointed out that pandemics are political in nature. I mean, it's not Trump's fault that this virus exists, but it's absolutely this administration's fault that it's been handled so poorly from beginning to end, and there's really no excuse for it. I have a friend who died recently, Dave Freeman. He was a big green, he called himself the Green Cowboy, an environmental activist, just wonderful man. But one of the things he always said about science in this political era is that he came of age during the Carter administration, and he was coming of age at a time when the amount of science and information we have was a dream for everybody, and they assumed heroically that once we had the science to do things better, we would do things better. And now we're at a time in history where there is no lack of research, there is no lack of solutions. What we have is a complete lack of political will to carry those out in a sane way, and we're sort of alone in that. Most global players want their citizens to not all die. Why America is behind in that, I do not know. Do you have any insight there, Alex?
Well, I think that there is an international system that, so we are alone in our like sort of hyper idiocy, which is some weird portmanteau with some French mixed in there, of what it is that America has, because the global capital system that prioritizes capital over people, even though there is no capital without labor, there is absolutely no ability for capital to exist if there's not labor which creates it. Just to divert over into Adam Smith for a second, because it's always fun. Read the book, libertarians and so-called capitalists. They hold this guy up as like, oh, he says the invisible. He doesn't say any of the things that people ascribe to him, he does not say that. Mainly, it is a very detailed rumination on how you make pins. It's just page after page after page of how much labor goes into making pins. And his main insight was that labor creates capital. And the big thing that he brought to the world was that countries shouldn't invade other countries to steal their gold, because that's not how you got rich. In fact, it was the labor that went into creating the wars to steal the gold that created the wealth. It wasn't the gold. So from mercantilism into what is a modern sort of economic view, but the view is that labor creates capital. Now we're in this system where capital is killing people. We have financialized people's lives and their health to such an extent that rich people are getting richer by turning nursing homes into death traps. Rich people are getting richer by denying people health care. Rich people are getting richer by ensuring that people who need insulin every day to live cannot afford that insulin to live. They want some people to die so that everyone else is terrified enough to go bankrupt. America is sort of the epicenter of it, or it's taken it to this new level. But that system is a global system of unrestrained capitalism. And this pandemic has laid it so bare that we need something new. We need to build something absolutely new. Maybe it's old, actually, but because this is the failed experiment of the last 30 years. Hey, maybe we should just let the billionaires do whatever they want and cross our fingers that it will work out.
Well, and I love that you bring that up, because you read Adam Smith and you realize he does have more consideration for laborers and workers, not only more so than the modern Republican, but more so than the modern corporate Democrat. The Wealth of Nations is filled with references to how do we do this in ways which are ethical to people's lives, which is stunning to read when you look at the ways that these ideas have been distorted into not only modern slavery, but to such an extent that even middle-class people who are the privileged in this equation, like you said, have had every moment of their lives. It's to a point where even if you're an upper middle class person, you're not sure if you're going to be able to afford healthcare at a time when we're all in massive pandemic crisis. Like, there should be some kind of system where people are all protected from an infectious pathogen for the sake of everyone else. That's what everybody else is doing. That's why South Korea has only had 300 cases. And what is our number now? Like, it's in the hundreds of thousands.
It's closing of deaths. It's right around 100,000. It'll probably cross 100,000 by the end of the month.
Which means the case number is way higher than we know, because nobody's even getting tested.
Absolutely. For 100,000 deaths, we have astronomical levels of COVID in this country. So we're going to be joined by Dr. Dery pretty quickly. But just sort of in the lead in there, something that he's going to talk about is one of the things is South Korea doesn't have a vaccine. South Korea doesn't have treatment. South Korea doesn't have any sort of magical ability that makes them different than the United States of America. All they do have is a concern for public health and following the science. And very importantly, they also they wear masks. Mm-hmm. They have near universal usage of masks. And that has been shown now. The epidemiology is nearing consensus opinion that universal mask wearing basically can drive this epidemic down to the point where we could control it and get rid of it before a vaccine actually comes on the market. Instead of pumping billions of dollars into these corporations unaccountably, pretending that there is going to be a vaccine created in months. Vaccines take years, sometimes decades to create. 4 years, I believe, is the fastest that there's ever been one. And the reason why it takes so long is because for a vaccine to work, you have to give it to enormous numbers of people. So let me I'm going to bring Dr. Dery in a second, but just I use this to explain it to someone who didn't get it the other day, and it made sense to them. I think a lot of people understand Vioxx and remember Vioxx. It was a painkiller that actually harmed people and it killed people. And it killed around 60,000 people because it was actually quite harmful. It was very dangerous, and the company that put it on the market, Merck, I believe, but I'll check that, knew that it caused harm. But the population that took Vioxx was smaller. So it was a big harm in a small population. Now, what you have with a vaccine is an enormous population that would need to take the vaccine. We're talking billions of people. So even if there is a really tiny harm in there, when you give it to billions of people, the outcome could be just disastrous. And that's what we're rushing into by just saying, oh yeah, we're going to create a vaccine in months. And you're like, well, how many months? 4 months? What if in the 5th month, there's a really bad reaction to the vaccine, but we didn't wait long enough in our testing, and we didn't have enough people involved in the studies, and we didn't share the data to ensure that this is safe. So I want to bring Dr. MarkAlain Dery on to talk about all things infectious disease, pandemics. He has spent a lifetime studying and fighting pandemics and is very uniquely situated to talk about COVID. He's practicing in New Orleans right now. Dr. Dery, thank you so much for joining us here on Solidarity with Jocelyn and Alex.
Thank you so much for having me, Jocelyn and Alex.
So Jocelyn, why don't you kick off with the first question?
Oh, I'm sorry. So I understand that there is light at the end of the tunnel. Is that true?
In terms of universal masking?
In terms of there are things we can do. We should all be wearing masks. Is that the correct?
Oh yes. If we had an opportunity to establish a campaign, like a global campaign, that put masks on every single person, including what Spain is doing now, is mandating masks for even children over the age of 6. If we were to put masks on everybody, quite literally the globe, and do it through 2 cycles of the incubation period of the virus, which is 14 days, so that would make 28 days. So let's say 30 days just to make it easy for right now. If we were to put masks on every single person, I think that we would see a significant decline in the virus transmission. I think that there would be an opportunity to allow the economy to reopen, for children to go back to school, and for life to resume back to a certain sense of normal, so that we don't rush into some of the things that I heard Alex talk about right before I joined, which I think were some very, very important points. Furthermore, I think it's super important to recognize that just this week, the CDC released 2 very important pieces of information. One was they have made the definitive statement that right now we're looking at asymptomatic infection rate of 35%. 35%. That is a tremendous amount. I mean, we're talking 1/3 of cases are people who are unaware that they're infected. And the second piece of information that they released this week was that contact onto surfaces and stuff, that is almost negligible with respect to transmission of virus. In other words, let me rephrase what they are saying. In other words, what they're essentially saying is that the respiratory route, so breathing, talking, singing, talking loudly, are overwhelmingly the greater likelihood of transmission of virus. So by covering your face with a mask so as to prevent transmission of droplets that the virus live on, or that's how they're transported, or what's referred to as spittle, is very, very important.
So, Dr. Dery, let me ask you, I don't want to go backwards in the interview, but I'm going to kind of do that because I want you we're going to come back to universal masks because it's the hopeful thing. But I want you to just sort of set up something for me. You've actually spent your professional career fighting pandemics. HIV, it's not a pandemic, but the Ebola epidemic. And you've fought some really nasty bugs. Can you just sort of tell us about that and your perspective now, currently treating COVID? And, basically, I want you to tell people that this is very serious, but that science does win. Public health does win. We actually know what to do. We just have to create the political will. And you are uniquely able to do so, having fought so many gnarly bugs across the world.
Sure. It would be a pleasure to do so. So essentially, I think with the Ebola epidemic is probably the first great place to start. But I also want to take back, I'm going to pivot, in the middle of that answer to go back to Indiana, Mike Pence's Indiana, as well as Ronald Reagan's 1980s to look at HIV as well, because I think those are very important parallels that we need to consider. When I first got to Freetown, I went to work as a clinical epidemiologist. What does that mean? I was mostly a contact. I did the initial 2 weeks of suiting up and working in the treatment center, and the WHO was like, no, we need you to do more relevant work as a contact tracer and epidemiologist to go and find cases active in Freetown. So when I got to Freetown, the first thing that I noted was just a gross denial of the virus existence to begin with. The folks just didn't believe in the virus, which is crazy to consider. And then they also accused different groups, both within Sierra Leone as well as in different parts of West Africa. Oh, the Ghanaians are the ones that brought it upon themselves, and this is why we have the virus. I'm like, well, which is it? Do you believe in the virus, or did the Ghanaians bring the virus aboard? It's okay. They just didn't recognize the virus, and that's largely due to the fact that 80% of the country are illiterate. Okay, so that's fine. But the important thing was once they started to see people dying and they started to see their loved ones die, that they began very quickly to recognize how important recognition of that virus and recognizing that it's the touching of the dead bodies. And once that became very clear that it was touching of the dead bodies that happened in a funeral or that happened in the setting where a body was being prepared to be buried, then that's when they started to very slowly back off. Alex, hang on one quick second. There's a box right here, buddy. Just grab that one right there. Thanks, man. I'm so sorry. Somebody was coming over to pick up some masks. My apologies.
That's important.
Yes. Masks for America.
So I think it's important for everybody to really process what you just said. A big part of the problem with the Ebola response was, first off, let me just put it into context of today. People were calling it a hoax.
Yes,
they weren't believing that it was real until it impacted them, and then at that point, you were able to institute public health measures. And Ebola is actually, I mean, you rein me in if I'm stating it too much. It's infectious, but it's not at all super. It's very deadly, but it's difficult to transmit. So it's actually able to be dealt with through some pretty standard public health measures that you just laid out.
I would push back just a little bit, Alex, and just say that you need very little number of virions, actual viral particles, viruses, as opposed to let's say a larger viral dose that you would need for HIV or something like, we don't know yet with SARS, but it is not quite as difficult to get. It's you just have to be very careful, just making sure that to not touch. When I first got there, the mortality rate was something like 70%, and we were able to drive it down significantly to less than I think 10 to 15% while we were there, and that was largely because we recognized that there were two very important things that we needed to do. One was to identify cases. So we needed to test, if you will, right? And then we needed to trace, and then we needed to isolate. And when we went through those very specific processes, we were able to drive the R naught, right? The reproductive number, that was something like 2.53, maybe even a little bit higher while we were there. We were able to drive it down significantly below 1. In fact, it got down to 0.2 while we were there. So that was largely due to the fact that the WHO, as well as Médecins Sans Frontières, and a little bit with the CDC, really invested a lot of resources and helped to build up a public health infrastructure right away, right? And so that we were able to, those three teams were able to split up Freetown into thirds, and then we were able to find cases and get them into the treatment centers rapidly, and then we were able to isolate folks. The other thing that's important to consider is that once the Sierra Leoneans realized that this was real and that it was affecting family members, the level of adherence to doing the right thing skyrocketed. They did the right thing once they recognized what the right thing was. And for them, that meant that they needed to be isolated and stay at home. Now, the Sierra Leoneans live in these, compounds. One family may have like a large compound that were with 8 different families live on or what have you. So another secondary part of my job was to bring food on a daily basis to folks, and was to make sure that they were being fed. So you see a large part of the government was also partaking in a safety net system in which people were able to stay home, but know that they were going to be fed at the same time. And so that was also very important. And so that was why there had high levels of adherence to to what our recommendations were. And ultimately, we were able to beat Ebola.
And that's the key, right? Ultimately, you
Yes.
can actually defeat bugs. That's
Right.
what epidemiologists and ID docs like you do.
Right. And in fact, my wife, who's a city planner, recognized, she when we first met, she told me, what you and I do are the same thing. I'm like, I don't understand. She's like, when John Snow took the pump handle off of the Broad Street pump during the cholera epidemic in the 1860s in London, 2 professions were born that same night: epidemiology and infectious diseases on one side, and city planning on the other side. Because city planners claim that that's when they're, because of course now you start planning cities around keeping people safe, right? So let me also just answer your question, and because I think it's very, very important for what we're seeing today as well. And that is in Mike Pence's Indiana 5 years ago, a small community of 400, I think it was Aurora, Indiana. I may be wrong on that, but 4,000 citizens there, something like 250 got HIV through IV drug use. And then when you look at Reagan's America in the 80s, we are still living with the downriver effects of what happened when HIV was not nipped in the bud, if you will. And again, this was largely due to what I consider the fact was that in the 80s, you had men who have sex with men, and you had IV drug users. And I think that there was a sense of, well, those are not folks that they're not our constituents. These are folks that we don't necessarily care about. This is there wasn't a sense of, oh, these are Americans that are dying. These were like, oh, those are gay men and those are IV drug users. When you look at Mike Pence's Indiana, I think that you saw the same thing. He was morally against the use of clean needles, when we recognize the science is very clear. It's like basically saying I'm morally against gravity. So I'm going to just pretend I'm going to float through the air because I don't care gravity exists, right? It just doesn't make sense, right? And then when we look at who's dying with the COVID-19, it is overwhelmingly and disproportionately low-income individuals, particularly communities of color, who have suffered and have been at the pointy end of the stick of discrimination, structural discrimination, and structural racism in medicine as well as in our society, and to a large degree for centuries. And so when we see that states are beginning to reopen, and they're not even following the very thin guidelines that the White House put out, like 3 pages or 4 pages. the most minimal of guidelines that the White House puts out. The states are just not even following that. And I am particularly concerned in it, and it breaks my heart and it hurts my soul to have to say this. But I think that there is an element of once there was a recognition of the people who are mostly and disproportionately affected by this virus were individuals, much like with the way Reagan looked upon those people who were dying of HIV and AIDS, and the same thing with Mike Pence's Indiana. These are lower income individuals. These are communities of color. And again, there does not seem to be a unified sense of these are Americans, and we need to do everything that we can do to save Americans' lives. We're very rapidly approaching 100,000 deaths. I just want to be very clear on my show that I do daily. We keep track of, because everyone uses the idea of war, right? That we're at war. So I have a table of all of the U.S. military deaths over of the most deaths that have been suffered as a result of war. And we have far surpassed Vietnam, we have far surpassed Korean War, and we are rapidly approaching World War I. So I put that in numbers that people can recognize. We were horrified with, 9/11, 3,000 Americans died. Of course, it's terrible. We were horrified. 1,500 people died here in New Orleans during Katrina. And then, we were, of course, horrified with the level of deaths of 53,000 and 58,000 for the Korean War and Vietnam War. And of course, those are all tragic deaths. And of course, it's not even considering folks on the other side, as well as innocent civilians. These are just American military deaths. But now we are rapidly approaching World War I. And to me, that is it's untenable to think that we even got here in the first place when a lot of this could have been prevented.
And
Alex?
At the same time, South Korea has had under 300 deaths.
Yeah, absolutely.
Under 300. And we are getting to 100,000 deaths. I want to let Jocelyn have the last exchange after I do one thing, which is to say that you can tell the whole story of bugs the same, and it's depressing because it always goes this, it's not real, it's not going to affect me. Oh my God, it affects me. And then it's like, what can I do now that I know that it affects me? And then it's like, okay, well, here's the thing: test, trace, isolate, public health, and then that can bring enough. It's not going to go away, but it starts bringing it in. It starts containing it and making it small enough that we can actually keep an eye on it, and we can watch for flare-ups, and it's manageable until we eradicate it, which is what we can do with bugs. So I want to probably end where we start with the idea, and Jocelyn, I want you to sort of synthesize it however you want, that again, we're not talking about high-tech things. We're talking about test, trace, isolate, mask up, COVID down, and we can actually get a handle on this pandemic.
Well, and I obviously everything you two are saying is depressing and true. Dr. Dery, what would, other than stay home, wear a mask, don't be an idiot, what call to action would you put forth to people? I mean, should we be virtually camping out in our senator's office and, waiting for them to do their job?
Not at all. Not at all. I mean, usually I recommend, of course, I am going to be starting a very aggressive campaign for some sort of universal masking, because I think that for us to get to the end of this epidemic quickly, and we're talking, we could do this in a month, and so if the economy is really at stake and getting children back to school is important, and making sure, we're particularly, we're starting to see governments around the world, especially I think in Hungary, we started to see some of the leaders are taking advantage, in kind of a Naomi Klein sort of disaster capitalism sort of way, where folks are being able to take advantage of these of the disasters that are happening, and you're starting to see governments kind of shifting into more of a right-wing sort of an oppressive and authoritarian manner. And so I think for us to be able to really get to the end of this epidemic in a way that is a classic, Jon Snow style. Jon Snow was an anesthesiologist in England. There was a cholera epidemic in London. He recognized, oh my goodness, the houses over here get their pump water. They get their water from this pump, and they all have cholera. And the houses over here get their water from this pump, and they don't have cholera. Germ theory wasn't, of course, known at the time. Louis Pasteur and Koch were, 20 years later. So he just went and just pulled the pump handle off. It was the most basic public health intervention in the world. Cholera cases went down immediately. And as I said, city planning was invented after that, when they started to recognize that indoor plumbing and clean water was very important for people's health. If we could get universal masking, again, the most basic of elementary public health interventions, everybody has got what my grandmother would use the Yiddish word schmata sitting around the house, right? That would be able to cover their faces and do so for 30 days. You don't need an N95. You don't need a fancy surgical mask that you see doctors wear. It just could be any covering, a bandana, a t-shirt, anything along those lines, would significantly reduce the amount of droplets or spittle that leaves the mouth. That's called source control, and we would be able to drive that viral load down. But in answer to your question, because you did say besides masking, to be fair, I ask people to please help fight the disinformation or the misinformation that is online. And I ask people, and I understand, I have recently reconnected with some family members that I had not known for some time. They'd seen me, active on social media, and I recognize that these family members have a different way of thinking than I do. I think somewhat conspiracy oriented, and some of their social media posts are really quite shocking, quite frankly, and it's just gross disbelief of this virus. And so I try to very gently point to information that's relevant. CDC, WHO, New York Times has been doing a great job. Washington Post has been doing a great job. CNN and The Guardian have been doing great jobs. And I'm not one that really turns to mainstream media. In fact, as Alex knows, I started an FM radio station here in New Orleans called WHIV that really speaks truth to power. And we're a social justice oriented radio station. But those guys have all been doing a really nice job keeping, tabs of what's happening. So the most important thing that I think that we can do is really help to fight the disinformation that we see out there, because I think that is incredibly important. And I think that is influencing people to do things like not wear masks in public. There's folks that are saying, well, I'm going to consume my own CO2. And Alex had a great line the other day when we were talking about this. I was like, what kind of mask is it that you're wearing? Is it a full bag over your head? Because yes, that will be very harmful for you. But if you're just wearing a simple mask, there's no way for you to take in your own CO2. And I think through gentle reminders and doing it with a level of empathy and compassion, because folks are feeling very anxious. We don't have a social safety network program in this country. I think that if we were to camp out, although I'm not asking people to physically camp out in our senators' offices, I think that this is the time now where we need to come together unified as a country to speak to the importance of safety net programs, like a Medicare for All program, strengthening the social security. Those are two things right there that I think are incredibly important. Making sure we have rent or mortgage freezes, I think, are incredibly important as well. And helping small businesses. I mean, it was with shock that we saw that the initial CARES Act, the money immediately went to these very large corporations and that did not need that money, obviously. And it was meant for smaller businesses, and those smaller businesses weren't able to get it. So I think together as a country, 330 million voices need to speak up to the powers that be in Washington to help increase and strengthen our social safety net programs. Jocelyn?
Yeah, thank you so much. It's depressing, but it's inspiring to feel like there are people out there who know what they're doing and are fighting the good fight. Thank you so much, Dr. Dery, for being on. And everybody, wear a mask. It's the easiest way to be heroic I've ever heard of. I mean, it really takes so little.
Absolutely.
I see people without masks. I don't understand. It takes such little effort, but thank you so much, Dr. Dery, for being on. And where can people find your radio show, find you on social media, etc.?
Thank you so much. I do appreciate that. So we have recently, some of my HIV monies and grants got rerouted to some COVID projects that I've been doing. So we were able to start a podcast. It's a 10-minute podcast comes out every morning called Noise Filter. It's 3 to 4 high-yield stories looking at COVID, but from the perspective of social, economic, environmental, racial justice. So it's not just, a doctor, two doctors talking about COVID. It's really looking at it with a lens, looking specifically at human rights and social justice. That's called Noise Filter, and those are on all the podcast platforms. The radio station I started is WHIV 102.3 WHIV community radio dedicated to human rights and social justice. And that website is WHIVFM.org. And I'm mostly a Facebook person, and that's largely because of the folks around me that do a lot of my social media stuff. That's where they put me. And you can find me at Dr. MarkAlain Dery or MarkAlain Dery.
Thank you so much, Dr. Dery. It's been a pleasure having you on.
Thank you. Thank you, Jocelyn. Thank you, Alex.
Thanks so much for everything. And I take a lot of hope from what Dr. Dery was just talking about, Jocelyn. I think that it's depressing to see the resistance to science, but it's also, first of all, I love talking to him. He's a rock star fighter jet pilot of the infectious disease world. He's literally a rock star. But his work in fighting pandemics is really, really important right now because they follow this path. There's something, we talk a lot about just sort of like, it's a philosophical, psychological thing that we need to understand to have empathy with people, is that they're super, super scared. They're terrified. Yes. And one of the first things that our brains do when we're terrified is just being like, it's not happening. Not happening. Nope. Because if I say it's happening, then I have to get scared about it, and I don't want to be scared, so it's not happening until it hits people in the face. And this is why pandemics are very predictable. It's like there's no magic. There's no, and then it just magically goes away. You're like, nope, it's not going to do that. It's just going to keep on marching. But this country is incredibly big. And so it shows up in pockets. But as more and more people are faced, like in Sierra Leone, when Dr. Dery was saying, when people lost themselves, that's when we do have an opportunity to just shift people quickly and be like, especially if there's something you can do, wear a mask. That's what you can do. That's the community that you can build. And we can say it's also how you can protect yourself. If other people if the government has let us down, and they have, and it's up to every person to protect themselves, this is what you can do. Put a mask on. Put a mask on when you go out. I'll also add, tell people to back up if they're standing near you.
Yeah.
This is what we can do to protect ourselves. And as we all protect ourselves, we will protect our crew, our community, and then we can really start getting this pandemic controlled. And in the end, we will defeat this bug, because that's what we do with outbreaks. Test, trace, isolate, lower transmission, and then we can tackle it. So I take a lot of hope from the data that's coming out. And I don't know, I'm not going to get in an argument with you about the bleakness of right now, because it is certainly bleak. But I hope that the fact that it could be as simple as everyone wears a mask for a month and then the pandemic is gone, that would be almost like magic. That would be the only thing that would be like magic, is that the lowest level of intervention could stop this thing.
Well, and it's funny that we're talking about this, because that is a public health trend, isn't it? A lot of times we like to allow powerful people to obfuscate and create very complex narratives about things, but most public health interventions are quite simple. When it comes to something like sexually transmitted infections. You know, condoms are not terribly high tech. This is true for a lot of very scary human problems can be fixed with very simple solutions that are frequently not implemented because, as Dr. Dery was saying, they're affecting poor people more than they're affecting people in positions of power. And that, I think, is one of the things that, at risk of continuing on this line of pessimism, because I do not mean it that way, it is something that we have to talk about, though, right? Because I have had so many people, Alex, people that I've been shocked to hear this from, being like, well, do you know anyone with coronavirus? Like, are people actually getting sick? And first of all, yes. But second of all, that kind of thinking is just baffling to me. Like, you see these numbers on the news, but the implication is, because these are not 100,000 people I know, well, you know, how bad is it really? Life should return to normal. And that's not the type of thinking that I want to be a part of. Like, oh, thousands of people are dying in communities that aren't a part of mine, so it's fine. Let's all go back to Applebee's.
So I completely agree with what you're saying, and I want to just like, I am this eternal optimist because I really do believe in the future and what we will build. But I also I have a painting in my office, and it's just this really beautiful painting of brass knuckles.
Nice.
And because sometimes in this dumb political environment, you really do need to remember to fight with brass knuckles, because what we're also up against is a moneyed class who do not care about people dying, and they will make money off of whatever. So, you know, what we're going to do at Social Security Works is we're taking these nursing home deaths, 27,000 people in nursing homes. The Republican plan is to kill seniors. And you know who the Republicans need to win elections? Seniors. So we are going to tell everybody who is in a nursing home and visits a nursing home, works in a nursing home in targeted states around this country. My list is right here. You can see the targeted ones. You probably couldn't read it, but this is what I work on every day. Pennsylvania, Michigan, Wisconsin, Florida, Arizona, North Carolina, Iowa. These are states that scare powerful people that the story will get told. So how do we get people to, you know, do you know anyone? Yes. And you're going to know someone too. And we're going to make sure that people actually know what's going on in their community and in their states. And we're going to scare these powerful people by actually doing they don't care about people, they care about power. And we're going to threaten their power. And that's how we're going to affect change.
Well, and I love that you bring up the nursing home, because I lost a member of my family to COVID, and the most scandalous and disgusting part of it was that up until he died, everybody was like being told, oh, everything's fine, we don't have any cases. And then of course it comes out that actually they had multiple reported cases. There were not even basic precautions being taken. And this is a trend that's happening all through this country. You have these care facilities that aren't prepared to face coronavirus and aren't being honest about it because there's no obligation to. We're a country that did not take this pandemic seriously until it was too late, and is still not taking it seriously, even when it is too late. So it is just baffling to me, the number of people I have heard say things to the tune of, oh, well, like, if you're not in an at-risk community, do we want to be a country that kills off its grandparents? I mean, I realize they're an obnoxious generation, but that's not the response I was going to go with. I'm very fond of most of the older members of my family, and it's really disturbing the callousness with which this has been approached from all levels, not just the political.
And I just to tie it back to this, and I think, you know, we also we can talk about the other places that we're seeing. What we're talking about is a system that actually puts capital above people's lives. So behind these nursing homes are private equity firms that are private equity barons. These are the new barons. These are sociopathic people who make, some of them make over $1 billion a year. And all private equity means is rich people making money with money. And so what they do is they buy something like a nursing home, and then they extract all of the value from it. So the first thing they do is create a complex web of entities so they can move the real estate over to a separate holding. And then they can take the solid things, the ventilators and the things like that, move it over to a separate entity, so that what's left is a legal shell. And then they cut staffing and they reduce the expertise of staffing. So they don't want registered nurse because they cost too much money. So then they understaff these facilities with low wage workers. They put as many patients in as possible. But the business model is not that being in long-term care is profitable. It's not. What's profitable is extracting the value from these nursing homes, and then they fail, but the only entity that's legally on the hook is the one that has no value left in it. That's the game of private equity. It's the same thing they did to Toys R Us. It's the same. That's their only thing they do. It's extractive, destructive capitalism, and it needs to be destroyed. It needs to be ended as a thing. And we do that with solidarity, with people standing together and being like, we're not going to allow for-profit nursing homes anymore. We're not going to allow private equity to buy up specialists in hospitals so that they can do surprise medical billing anymore. We're not going to allow private equity to financialize my health and well-being and the health and well-being of my children, because that's not what society is made for. Society is not created so that some handful of people can have golden yachts. Society is for all of us so that we can actually live in a meaningful way. And that's what this show is all about, exposing these systems. And it's pretty easy because it's always the same bad guys, right, Jocelyn? I mean,
it really is.
It's always these greedy liars on Wall Street, and the answer is always solidarity. But I want to really walk as many people through this as possible. You know who's behind the pharmaceutical corporations that didn't actually prepare for a pandemic because preventing a pandemic is not profitable? Private equity. These are the villains of our age. When our age is written up, the private equity barons are going to be the villains that the people had to band together to defeat. And Jocelyn is going to be at the tip of the spear, at the barricades, waving the flag. To me, brothers and sisters.
It's all I've ever wanted to do with my life, Alex. It's so funny that you bring this up, though, because I do think that it's not intuitive and it's not obvious to people. Everything you said is so clear and it's so cut and dry. And if you're basically reading the news and looking for this, but the way, and I don't like to criticize the mainstream media too much because we have a president that's doing that enough, and that's not the side of history I want to be on. However, I do think it's important that this is not necessarily how things are going, is not how we talk about it. We are still talking about Wall Street as a valid player and a contributor to our economy. An economic system, which is essentially a grafting mechanism for a very small number of people, is not a healthy economy. And you have people who fundamentally do not understand what's going on. I attended a very conservative university, and it was really interesting how we would read old school capitalist texts and talk about things like profit margins and supply and demand. It's like, yeah, that's all well and good, but that is not how modern capitalism functions. It's not like there's like, oh, Wall Street is creating these ingenious new things and no, it is a grafting class. It is a parasitic class which creates nothing, provides nothing, makes life measurably empirically harder for everybody else. And yet for some reason, very few people seem to understand that. because they've been gaslit by their own poor understanding of how economics work. And that is, as Alex said, this is what this show is about. We are telling you, no, it does not. While we're talking about elder care, this is an incredibly, incredibly, incredibly expensive thing. People are paying hundreds of dollars a day for grandma or mom or whoever to be mistreated by a bad system. It doesn't have to look like that. It doesn't have to look like that at all. We could have a country where making sure your parents receive the care they need isn't a bank breaking phenomena, and you have confidence that they're actually getting taken care of. And
the only price we have to pay for that is there's going to be fewer of these billionaire assholes, which is actually a societal good in and of itself. So this is, as the economists say, pure Pareto efficiency.
Right.
We are looking at a win-win scenario: less billionaire assholes, more rational and caring society that doesn't leave us in a situation where we're wondering if our parents are going to be mistreated at a facility that, as you note, is also destroying all the wealth that they've accumulated over their life. And I can just go for a second on this. We don't have a long-term care system here, so there's a whole industry to actually help people get long-term care, to go through what they call the spend down, which just means transferring assets so that a person then qualifies for Medicaid, because Medicaid has become the de facto long-term care provider in this country. That makes absolutely no sense at all, that people have to literally go bankrupt and get divorced in order to get substandard, or it's sort of a luck of the draw thing, because there are some facilities that are amazing, few and far between now, but then there are some that are basically, they're going to abuse people. And all of that can be corrected very easily. You just kick the billionaire assholes out of the equation, and we work together to build a long-term care system, just like all of our peer countries have. It's not remarkable, right? It's not like, oh man, we need to fly to Mars. You're like, no, we just need to do what countries that have 1/8 of the wealth of us are doing right now. And that, I'll just sort of toss it back to you with the reminder of how rich America is, because I think people just misidentify how rich this country is, because so much of it is held by so few people. Our GDP is $19 trillion a year. Germany's GDP is under $4 trillion. $19 trillion. Germany's $4 trillion. I want people to understand that not having these systems has nothing to do with being able to afford it. Countries that are far less wealthy than our country are doing far better by their people than us. It's not complicated. The billionaire greedy liars on Wall Street are pretending it's really complicated, because the moment the people figure out that we just got to throw these guys out and take their ability to get another golden yacht away, and then we have the world where we're comfortable living in, and we can do so many great things. Maybe go to Mars. I think that comes a while down the road. Why don't we figure out a way to, not have so much? Why don't we build an economy that doesn't actually function on extracting resources, oil, and from the earth, and in the process destroying the earth? It'd be super easy to do, again, if we got these greedy liars on Wall Street out of the way, because the extractive industries are part and parcel of it. Anyways, I sort of meandered into my favorite place, which is that we can create immense amounts of wealth by doing the right thing, just as easily as these greedy liars create immense amounts of wealth by doing the wrong thing. The big difference is by doing it so that it benefits the people, that is how we build a future that we want to live in. If we leave it up to them, they think that they're going to be fine on their private islands with their golden yachts, even though they don't know how to drive their golden yachts. So I don't know who they think is going to do that for them.
Well, we're coming towards the end of our show, but Alex, I love this. You make me so happy with the words you speak. Yes. And it's, I think, the final thing I would add is I think that we as Americans need to overcome our psychologically conditioned need to fetishize wealth. It's not exciting. It's not good. You can be wealthy enough to have an entire estate, and that should be allowed. You do not need to be wealthy enough to have multiple estates. So many estates that you don't even know what you would do with them or how you would split your time between them. And in the process, destroy the infrastructures that make life livable and beautiful for everybody else. That is fundamentally unnecessary. No other country does it. And I love that you bring up the GDP of trillions of dollars. Trillion. That is more than 999 billion. And people, I don't think we can't even mentally wrap our minds around that much money, because it is more money than anybody could ever spend in their entire lifetime. We have the resources and the material abilities to feed people, to create healthcare systems which are founded on justice and science and good technology. We have the resources to fight climate change. We're just choosing not to. So, however, the answer is solidarity, right, Alex?
It always is solidarity. The problem is always the greedy liars on Wall Street. The answer is always solidarity.
Well, on that note, you guys, I hope you join us again next Friday at 11 a.m. With solidarity, we can accomplish all things, including bring down the coronavirus. So in the meantime, please just wear a mask. It's so easy. So buy them for your family, buy them for your friends. Thank you so much for being here. Thank you, Alex, and we'll see you all next Friday.
Bye.